My name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I am joined by health coach Andrew Mattera, and we're going to be talking about health coaching and his role in primary care. So good morning and welcome.
Thank you. Good morning.
So it's wonderful to have, I think you're the first health coach on the show, so thank you for that. So since it's your first, why don't you tell folks a little bit about yourself?
Sure. So my name is Andrew. I work in the Northwestern primary care, and I've been here, about almost, 11 months, and it's been amazing. I absolutely love what I do and working with patients every day.
So what is health coaching?
So health coaching is this kind of new wave and new form of preventative medicine where instead of just prescribing medications, we actually go in, we see a patient and make small lifestyle modifications, like talking about their diet, their exercise habits, stress, sleep, and just tweaking little things at a time to make these long-lasting lifestyle changes that in the end, they don't have to see us anymore. And so maybe they don't have to go on any kind of medication for diabetes, or they kind of get out of that quadrant of being obese or even stress. It's a lot. Wow.
It sounds like it. So how does it work? If I'm a patient in primary care, how does it work? How do I get to see you?
Well, so how you get to see me, so I work right in the hub with all the providers. And what happens is the providers will go in, they'll kind of assess where they're at, and they'll always mention, I think to every patient, they always mention that we have a health coach on staff. And sometimes they will say, just meet with them for just a second. Or other times the patient is just like, oh yes, like send him in, I want to talk to him. So we usually call those warm handoffs where I'll just go in, I usually give a little spiel about what health coaching is, how I can support them, and then sometimes they will, I'll book them right there. Sometimes they'll want me to follow up in a week, and sometimes the provider will go in and they just want a referral, and they'll come out and they'll schedule with the front desk staff. So it's really just like this big team effort, and the providers really have to know who I am. So the past 3 months that I've been in primary care, it's been really just kind of getting to know me and what I can offer.
So you've described a little bit about what you offer. So if I'm actually a patient experiencing the health coaching, can you give me a little bit more specifics of what I might experience so we take the mystery out of what is this health coaching?
Yeah, so it's really, my first question is usually, where do you want to be? What's your ideal self that you see farther down the road? And then just slowly peeling away the layers until we get to that root of, okay, what is that motivation to get there? What strengths do you have that we can use? What challenges do you see? What are your priorities? What are your support systems? And it's really going very slow. And all the autonomy is on the patient. So that's a big thing that I always stress, is that they have full control about what they want to change. I'm not pushing anything on them. I bring my own experience, my own training into the process to kind of guide them along, but I'm not an expert. I'm not a doctor, so I'm not telling them what to do. It's very much just kind of going with them.
So you mentioned your training. What is the training to be a health coach?
So I have been trained through the Well Coaches program, and that is this really great organization that has come up that's training health coaches to work in any kind of environment. And so my training was about 6 months, and it was broken up into 3 pieces, where the first part was an on-hands training, about 4 days intensive. It was great. I absolutely loved it. And then the next phase was this longer process of studying and working on all these different modules on motivational interviewing, how to be empathic, and how to support your patient. And then the last process was going through an intensive certification of doing a mock phone call coaching session, having a written test, and then the practice for that. It was very intensive.
Sounds like it.
It was, yes, but it was really great, and it really helped me prepare to be in primary care.
So what type of patients do you find that you're seeing in primary care?
So with any patients that come in, what is kind of different about my role as a health coach, usually health coaches see a very specific group of patients or people where they're ready to change. They're usually younger. They don't have a lot going on as far as like health issues. So my role, what's a little different is I go in and I see anyone and everyone who's at any kind of level and they want to make some kind of change. And so I will usually assess where they're at. And some patients, they are within my scope of practice to do health coaching. And so these people can be at any readiness of change, and they just have that motivation and they can be supported by me, while others need something more. Where I saw someone yesterday where they needed more than what I could offer, and so I had to support them with showing, okay, we have dietitians on staff, we have smoking cessation experts, we have diabetes educators, and it's really talking about how they can support them, because providers don't have a lot of time to really sit down and dedicate that time to explaining all the different ways that NMC can support that patient. Did that answer your question?
That was fantastic, actually. So when you talk about readiness to change, so how do you know if someone's ready? So if someone's, listening to us and thinking, am I ready to make that change? So how would you assess that readiness to change?
Sure. So it's usually within like the first 10 seconds I can tell if someone wants to work with me further and they are just super motivated, because I usually can just give that 5-minute spiel about how I can offer that. And if they're really motivated, if they really want to make these changes and they're in a place to do that, then it's just like instantaneous. They're like, okay, yes, I can do that. Where other people, they may be a little pre-contemplative, people who have been trying different things for a really long time and nothing's really worked. So then me coming in and being like, oh, okay, this is how I can offer and support you, they're a little hesitant. So that sometimes takes a little bit of time to kind of explain how I can support them. And then usually if they're pre-contemplative, my job is to just slowly support them. So then they get to that contemplative phase, and then they get to that action phase and maintenance phase. So it's really supporting them in wherever they are in that readiness of change. And so it kind of goes back to how I can support and work with anyone and everyone and where they are within their lifestyle.
So it sounds like your biggest skill is about listening and really hearing where people are at and helping them make that next step if they're ready, in which to do that, and reflecting for them. So when you say they're in the driver's seat, they're really the ones you're helping them figure that journey out and break it into pieces, manageable pieces.
Exactly.
Maybe do you do goal setting or with them? Or
We do a lot of goal setting, and that's kind of like a big part of it is goal setting, and I don't push that. Again, it's where they are and when they're ready. Usually I can tell very quickly, okay, let's talk about setting some goals on this very small, specific thing that'll lead to bigger goals. And so we usually try and set maybe a 1-year goal or a long-term goal, a few months goal, or kind of a mid-range goal, and then weekly goals. And so those weekly goals turn into those and support those long-term goals. So it's really just supporting them and wherever they're at. And again, the big thing that you mentioned was reflecting and listening.
Right. Yeah, people sometimes just need someone to listen,
Exactly. And so it can be a little daunting to come in to see your provider and there's so much going on. You have so many questions, and then them being like, oh, we have someone else here who can dedicate a little bit more time to talk about how they can help with, maybe your high cholesterol, or maybe they're pre-diabetic and just need some small lifestyle modifications and just some support, someone who has that experience. And it's not that the private providers don't want to do it. It's just that, they have so much time that they can dedicate to that.
And sometimes if it's a wellness visit, they see the provider like once a year. And if they come in healthy on that day, a year from now, things could slip.
Exactly.
Right? So it sounds like you're trying to keep those that are coming in healthy, trying to keep them healthy and on course, but you're also open to seeing everyone who is ready, wherever they're at in their health journey, that might be able to even potentially reverse a chronic condition or prevent a chronic condition from happening. So keeping people healthy, that's incredible. So when you meet someone, do you set up repeat appointments, or do you just get one time with them?
So
how does it work?
So with that, again, it goes back to that readiness of change. And some people, it can be really daunting to think about meeting with someone weekly or even bi-weekly. So again, I can usually tell within a few minutes how often they want to do this. And so it's just assessing that readiness of change. But mainly I do see people who are super motivated that want to come back weekly. And that's usually where we see the best results. But I always support the patient. And I don't say you have to see me weekly. It's like, how often do you think you can come in and I can support you? But
wow. What a service.
but most patients, they will start off that way, and then slowly they see, okay, I need to come in a little bit more weekly or more often for that extra support.
Wow. So you mentioned you're at Northwestern Primary Care. Are there other health coaches? Do you have other team members?
I do. I have another team member is Kate Robinson. She works at the Georgia Health Center, and we worked together for maybe like the first 7 months. We worked really closely together. We got to know each other. And what's really great is that we both have completely different backgrounds. So we were able to support each other and other patients. So it was it was really good. It was a really good learning experience. I learned a lot from her, and it was such a great experience to meet someone with a completely different background and see what she had to offer.
Wow.
Yeah.
Great. And how long, you said you've been doing this just a few months?
So I've been in primary care since September, October. And then before that, I started in February working with Dr. Fontaine of the Lifestyle Medicine Clinic, where I spent the first 7 or 8 months just kind of training, getting to really refine my coaching skills, working really closely with the dietitian, Lindsay Hoare. So it was this really great learning experience that really kind of helped me be ready to kind of go off on my own and be in primary care and use all these tools that I really honed down to help support patients.
That's fantastic. Now, without any names, do you have like a success story? Do you have something that you feel good about? I know you're early in your career with doing this, but is there somebody that comes to mind that you could share a like experience that of how maybe you've made a difference?
Yeah, of course. So I have 2 patients that really kind of stick out, and they couldn't be more different. Where one of them is pre-diabetic, and they have lost over 30 pounds within the first 2 months of doing health coaching. And but it really goes back to motivation. They found out that they were pre-diabetic and they did not want to do it. So we changed small lifestyle modifications to their lifestyle, and then the weight just dropped off. And then another patient who I've been working with around the same amount of time has lost almost 40 pounds. And this is someone who has been exercising their entire life and haven't really gone anywhere. And it was coming in and just changing small things, and it just had this huge impact on everything else they were doing. And I brought my own experience of being a personal trainer and a strength and conditioning specialist to kind of look at their exercise routine and just slowly tweak it to kind of where they're at, and they've lost almost 40 pounds.
Wow, congratulations.
You know what?
To them too.
Yes, it's not me. It's all on them, all them.
That's fantastic.
Yeah.
Well, what do you do to keep yourself healthy, so that you're role modeling, obviously, what you want to help others do. So how do you keep yourself healthy?
Well, I will say that one of the things is even a coach needs a coach. And I will admit that, and I have a great team. And so being able to go to them and kind of talk about like,
nice.
okay, like I'm having a hard time with my own wellness. And so they can kind of support me. So what I like to do is during the day, as a really nice like 10-minute break, I will go to our wellness room in Northwestern Primary Care, and I'll just do like a 10-minute quick workout.
Wow.
And I also teach a HIIT class in not primary care, but in the hospital on Tuesdays and
wow.
Thursdays for the employees. I do a lot of hiking. I hike constantly, pretty much every day, and I do a lot of yoga, a lot of mindfulness. And
wow.
I absolutely love to cook, so I try and be as active as I can and be a good role model for everyone.
That's fantastic.
Yeah.
Well, thank you so much. I look forward to you coming back on the show in the future to talk about more successes and how health coaching is further developing across our community. Thank you so much.
You're welcome. Thank you for having me.
Yeah, it's a pleasure. I'm Jill Bowen, and it's been wonderful to be with you today to talk about health coaching. It's something new. You're finding it in primary care. And it's someone there that can listen to you and help you reflect, not to push you, but to encourage and hopefully inspire you to take one more step to a healthier you. Thank you for joining us today.